Welcome to the Health AI Brief, breaking down the AI shaping our world one concept at a time. At the heart of diagnosis is classification. Is this tumour malignant or benign? Is this rhythm sinus or AF? Sometimes the distinction's obvious, but often the data points overlap and the boundaries a bit more blurry. This is where support vector machines, or SVMs, excel. Their entire job is not just to separate the sick from the healthy, but to draw the widest possible safety margin between them. Imagine you have two groups of patients plotted on a graph. Group A has a disease, Group B doesn't. An SVM looks for the line that separates them, but it doesn't just pick any line. It looks for something called the hyperplane, the boundary that creates the widest gap between the two groups. It identifies the specific patients who are the most difficult to classify, the edge cases sitting right at the boundaries. These are the support vectors. The algorithm ignores the easy cases and focuses entirely on these difficult cases, the ones that are defining the border. So what if the data is mixed up? Imagine red and blue dots on a sheet of paper, but the red dots are in the middle of a ring of blue dots. You can't draw a straight line to separate them. The SVM uses a mathematical trick called the Kernel Trick. It projects that 2D paper into three-dimensional space. It lifts the red dots up, so you can slide a flat sheet between the red and the blue groups. It solves complex problems by adding dimensions. The clinical value here is precision in high-stakes, high-complexity fields. SVMs have historically been excellent at, with genomics and radiomics, areas where you have thousands of variables, genes or pixels, but perhaps not millions of patients. They're incredibly accurate at finding patterns in high-dimensional data. The weakness? They're computationally slow with massive datasets, and like the random forest, they can be hard to interpret. It's hard to explain to a patient that they were diagnosed based upon the fact that they fell on the wrong side of a multi-dimensional hyperplane. So the bottom line is that SVMs are the precision scalpels of AI classification. They define the boundary when the diagnosis isn't black and white, even if that boundary is quite complex. So that's SVMs in a nutshell.